What's the demographic of people who usually are diagnosed with nephrotic syndrome?
Yeah. So people can get diagnosed with nephrotic syndrome across their lifespan. So this is the glomerulus that can get injured in nephrotic syndrome. And most often the cell type that's damaged in nephrotic syndrome are these podocytes, these little octopus-looking cells. These are epithelial cells that wrap around the glomerular capillaries or the blood vessels. So there's something called membranous nephropathy, and that's more of a condition of older individuals. There's also steroid-sensitive nephrotic syndrome or minimal change disease, which is what you see on a biopsy. And that's who I see the most. These are kids who typically present between like 3 and 8 years of age. And then there are other forms of nephrotic syndrome that are like FSGS. That's what we see on the biopsy. It's all complicated because nephrotic syndrome can arise across the lifetime. And just because it looks like nephrotic syndrome, it doesn't mean it's all caused by the same thing. So there are different forms, and it's hard just to tell by someone's response to steroids or what's on the biopsy, what kind they have. So that's what we're trying to use genetics to try to classify these forms more accurately. But the punchline, if you ask me to say, Matt, you talk a lot, you say a lot of different words, but the demographics is nephrotic syndrome can occur across the lifespan, and certain forms of steroid-sensitive nephrotic syndrome, typically in the late toddlerhood to early elementary school, but recognizing that it can happen across childhood. And sometimes the ages of onset can give us some clues, or a person's self-reported race, which reflects their genetic background, can also help us understand it.